Okay, this happens all the time, and I've run into this so many times. I work for a busy 3-doctor orthopedic surgeon practice, and we have been experiencing serious revenue issues with increased denials in money takebacks. I'm not sure where to begin resolving the problems, but the surgeons are getting very concerned. Do you have any recommendations? This is very common. If we were talking about primary care, it's most likely that the front desk didn't get the right information and update the registration. The wrong insurance was billed, money was taken back. But in this question, I focused on 2 things. One was that it's an orthopedic surgery practice, and 2, money takebacks. Orthopedic surgeons, chiropractors, physical therapy, diagnosis codes that they deal with a lot of the times begin with 8 and 9 and ICD-9, accidents and injuries, which is a red flag to insurance companies that you have to give a lot of information to indicate if it's a health problem or if it is a liability case. If a patient goes in and the diagnosis is a broken finger, they may not pay that right away unless you have enough documentation in there to indicate that it was a workers' comp, a motor vehicle, or if it happened at home. And so with orthopedic or any specialties like that, you want to prime the patient when they make the first phone call. You want to be able to assess before the visit so that you know ahead of time what to tell them, because I know so many doctors' offices who will bill the regular health insurance, and then 6 months, 2 years later, all the paperwork catches up, and they'll take thousands of dollars back from a physician and say, we weren't supposed to pay for this. This person had motor vehicle coverage. And so you want to make sure you have that up front, because you want a clean claim. Doing appeals is not fun. And as far as losing revenue, that's a whole other night, but there's hundreds of reasons why your revenue could drop. But right now we're focusing on the takebacks. So the first thing would be is that the front desk should know how to obtain information from the initial phone call and eliminate the wasted time. You want to establish the nature of the patient's complaint and try to determine what type of problem it is. I know in primary care, if it's something very embarrassing or personal, they may not tell the front desk until they see the doctor. But if you're talking about an orthopedic surgeon practice, they're not going to be worried about genital herpes. They're talking about neck pain or a sprained ankle or back pain. So if the front desk can find out, like, what's the complaint, and, you know, how did it happen and where and when did it occur, right away they're making the determination if in fact it is a workers' comp claim or motor vehicle or personal injury. And so if it is work-related, you want to know, has the injury been reported to the employer? If they said yes, you should try at the time of the phone call to get that information, the claim number, the accident date, the claim rep's date, name of the employer and the insurance carrier. But if not, make sure they bring it in when they come to the office for the visit. If they didn't report it, they really have to. And when you schedule the appointment, the first thing that I always have managers do is, if they have the information, call the insurance company and verify everything before you put that first claim out. And if they don't, call the employer to see if it was even reported, and make sure the patient signs a lien that they're responsible for payment if the workers' comp or doesn't work out. But you really want to make sure that you're billing the proper insurance company, because if you just bill Blue Cross Blue Shield, you can bet that money's going to be taken back, because it all catches up somewhere down the road. So when the patient comes in, they should have the claim number and all the insurance information. Whatever the diagnosis code is reported to the workers' comp carrier is usually the one that you would use first. It is the one you use first. If they have back pain from lifting something heavy, and then it turns into neck pain because you're like protecting your back, you can use that as the second diagnosis or whatever, but you want to correlate everything to what the workers' comp has agreed to pay on. And then again, make sure the registration form is filled out correctly and complete, checking dates of birth, and know that the very first visit if everything's in order with the insurance company, is that utilization review will allow you that one visit without pre-cert or authorization so that you can see the doctor. But then you really have to talk to the workers' comp people to get permission for the treatment plans and everything that's involved with the workers' comp case. And the guidelines are established by workers' comp utilization review, and you want to follow them in order to avoid claim denials and being reimbursed in a timely manner. And just to throw in, even, with the ICD-9 and ICD-10, is that workers' comp and motor vehicle do not fall under HIPAA guidelines, so be wary of that when you're coding after October 1st, 2015, because it's going to vary by state, and so we don't know. So you may end up having an extra job to find out, what's going to be accepted if you happen to work in a place like an orthopedic surgery group, because that's a bulk of what you do. Now, if it's a personal, you
were going to say, you're telling them they may still code an ICD-9, right? Yeah, that's what you're saying. Yeah.
Yeah, they don't follow HIPAA guidelines. My guess is that they will cross over at some point, but you want to make sure.
That's a good
OCD
way of telling
when it comes to.
Yeah, that's a good way of, though, because we do get a lot of people that ask, don't we, Joanne, that say, oh, well, if it's switching, I just need to know ICD-10. No, depending on who you work for, you may need to know ICD-9 and 10 in the future.
Right.
Okay, sorry to interrupt,
honestly,
Joanne.
No, but you know what? ICD-9, if you know that, the transition will be much easier with ICD-10 because all the rules and the way you maneuver the ICD-10 is similar. There's a lot of different things you have to learn, but if you're good with ICD-9, then I think you'll transition to ICD-10 with the little training easily. Now, as far as personal injury, talking about a motor vehicle, basically it's the same thing. Prepping the patient ahead of time, you want to ask for the date of the accident, get details of the accident, whether the patient was hit or they hit someone. You want the automobile insurance information. You want to know if the accident has been reported. And again, always verify with the insurance company. Don't trust anything they say. And honestly, a lot of patients need to be educated. They don't understand. So sometimes they just give you the health insurance card. They don't understand. They should sign a lien, once again, which is a binding agreement between the patient and the office that allows you to collect the medical expenses that are not covered by the motor vehicle or the health insurance. Now, some states have what's called personal injury protection. Many states, it's called no-fault car insurance or PIP coverage, and that's to protect drivers from delayed payout for personal injuries. In Massachusetts, we have that. So it's important for a practice to understand their state rules on personal injury. And if they do have a PIP, what happens is if you have your claim and all the information in order and you send your insurance claims to the motor vehicle, they will pay up to the first $2,000. That does not mean that you will get all the $2,000 because of X-ray technician or emergency room, whoever gets in there first, they'll take their portion of the $2,000. Once you get paid and the $2,000 is met, then the doctor's office will receive what's called a Pip Exhaust Letter, and that's saying that they've met their $2,000 PIP. And with that letter, they can then go forward and bill their health insurance as proof that the PIP was exhausted. But what I want to point out is that if you're seeing an orthopedic surgeon and, everything is fine and motor vehicle is covered, but he's not on an HMO that you are on, you are not. He is not going to get paid for those HMO visits. So you want to be sure that if you're in a state that works with personal injury protection and you're going to have to use the health insurance, especially PT and chiropractic, where there are a lot of caps on services, you want to be sure that the health insurance, the doctor is an in-network provider, or the patient will have to pay out of pocket. And so assuming that there's a cap and that the health insurance is done, there is also something called Medpay, which is built into insurance companies, and each plan is different, which gives you an additional $6,000, meaning that you have a total of $8,000 in personal injury coverage. And after that has been met, then it's up to the patient to pay. And so if you have HMOs with co-payments or PPOs with co-insurances, you can bill your motor vehicle for that. But basically, you have to know what your state, allows and doesn't allow. And if they are one of the no-fault insurance states, you want to make sure that you have everything in order, and especially if your doctor is part of an HMO or not. That's major. And then basically slips and falls, if you have an accident, like in the supermarket, there is no personal injury protection or anything like that. But it's the same concept, getting all the information. Health insurance cannot be billed, but the only difference is that claims are usually paid at the time of settlement. And this is just talking about patients in the medical office. A lot of these incidences they'll also involve attorneys. I usually work directly with the insurance and the doctor and get the money fast, but some attorneys do get involved, and that's a whole other issue that I won't talk about. But but coding and knowing the insurance, verifying eligibility is so important, because with the wrong insurance, the money is going to be taken back. And as far as low revenue, that's another webinar when we start talking about reasons for denials, because that could go on forever.
So
that's really it.
Tell that Joanne has had to deal with this a lot, can't you?
Yeah. Oh yeah, it's and you know what? It's not fun to appeal a claim. It's much easier to get it right the first time. And if you train your front desk to ask the right questions, it's really not that difficult. So
that's good. That's good.
Anyways, that's it.
Thanks, Joanne.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.